Welcome back, everyone, to API Days India 2022. So we had insightful keynote presentations from Dr. Zapin Kapazi and Namrata Mahindo. And to continue the healthcare and data aspects of this, we have on this stage, we're going to be talking about data-driven business. I'm very delighted to invite Santosh Marathe. He's the regional CEO of the Western region at Apollo Hospitals. Welcome, Santosh.
Thank you, John.
So we've already heard a little bit about the challenges and the opportunities of delivery of healthcare, and so it would be great to have your perspective, particularly on how big data enables the delivery of healthcare to those who need it. I'll just check that we can see your slides. Okay, over to you.
Yeah, we are good to go. Wonderful.
Yes.
So firstly, thank you for the invite. And as the topic suggests, I think big data and your moon, better, bigger insights in healthcare is what we will spend some time in deliberating on. So before we get into the overall presentation, just wanted to give you an overview of what we do at Apollo Hospitals Enterprises. So this is the Apollo Circle of Life, where there are multiple verticals under which we operate. The first one, the key one, is obviously the chain of hospitals that we operate on. We have 72 hospitals pan-India. There is a separate education and research foundation wing, where there are a lot of activities happening under research, education, publications. There is a separate vertical which takes care of ambulatory care clinic setups, pan-India. This is again interstate, multiple states that we have presence in. There is another separate vertical where we focus on health and lifestyle, which predominantly looks into occupational health centers across corporates and across entities and district zones. There is a whole line of chain of pharmacies that we operate into pharmaceutical distribution, the supply chain part of it, and that has occupied more prominence with COVID vaccination occupying more prominence in the private segment. There is an Apollo Global project and consultancy wing, which we undertake greenfield and brownfield projects, both in the Indian and overseas context. There is an insurance vertical under Apollo Munich, and there is a telemedicine networking foundation, where there are a lot of IT-enabled solutions which we bring on board in terms of the overall day-to-day healthcare practices. There is another vertical, which is Apollo Health and Knowledge City, where a lot of new innovative ideas are being brainstormed, brought to fructify to practice. So that's an important aspect which we all are always eager to learn from. And the last vertical is Apollo Sachi, which is Save a Child Heart Foundation. So all our donations and NGO activities in cross-subsidizing cost, which is very important in the Indian context, are taken by this vertical. So typically, as we indicate, it's a circle of life which completes the whole fulcrum of healthcare activities that we provide under Apollo. So in a simple term, just to enumerate what is our healthcare goal: we prevent disease when possible, we cure disease when we can't prevent, and lastly, we provide care and comfort when we can't cure. I think this is just a snapshot of our day-to-day activities, how life at Apollo continues. So let's take a pause and look at the new global business environment. I think multiple dynamic changes have been happening over the past year-on-year basis, over the past decade. Cost cutting and austerity measures have occupied more prime importance in any industry. And obviously, healthcare is not immune to that industry also. Weak dollar, volatile oil prices have been the wake. And as if that was not enough, we also have the war unrest in most of the countries happening. And that has definitely influenced the overall way in which business environments are getting operated in multiple countries and multiple regions. Dynamic competitive landscape has been a story and a real fact across all segments of industry. And more prominently, we are seeing a lot of good restructuring happening in healthcare in particular. Obviously, the healthcare business models are getting evolved. In the Indian context also, there is this concept of accountable care organization, which is evolving and gaining grounds. Value-based payment is something that we are being in discussions with the payer group, including the government authorities, where most of the medical coverage still continues to be funded by the government authorities. An ambulatory model is something which we'll touch upon in the latter part of the presentation, which has been an outcome of the pandemic scenario, where IT adaptability and those kind of things have been really taken up quite aggressively. Another important change we are seeing across all industries is that the introduction of products with shorter and shorter life cycles. Because of innovation, because of technological upgrades, we are seeing that the life cycle of the products is undergoing a change very, very radically. Handheld and mobile device proliferation has been definitely gaining grounds across the industry, and most of the handheld solutions have been usage and a way of working and living for most of the citizens. And fast evolving regulatory framework, which is very important to have in terms of the governance and in terms of facilitative activities. And in the Indian dynamic in particular, there are a lot of public and private partnerships which are gaining ground, as we call it, as coin it as PPP in the Indian context. So let's get to the main topic. I think big data, big changes that we are talking about. I think one of the significant changes that we have seen in the healthcare system in particular, I think the paradigm shift from legacy historical analytics to getting into forecasting predictive analytics. I think more and more IT enabled solutions are now getting integrated with a very strong clinical decision support system, which really facilitates all our care providers in making good educated decision based on evidence based practices. So that has been one of the biggest opportunity, frankly speaking, and still utilizing or leveraging this opportunity has been a challenge for most of the healthcare providers. But in the Apollo context, we can proudly say that we are the technology leaders in the region, and obviously the adaptability and the integrated solutions that we have taken up in the HIS solutions have really helped us better our clinical care activities across all the spectrum of care continuum. Internal and external data challenges, again, I think a lot of data is getting flowing in with structured, unstructured data. There is a mobile data getting in, there is GPS data getting in, there are machines which are talking, machine learning solutions which are being provided, the HIS is connected, there is inter-data portability which is happening between multiple care providers. So all that thing, I think it's a very vibrant market out there. And obviously, as we all know, that data is the new IPR, the new intellectual property right. And if handled well, I think definitely that can lead to voluminous gains in terms of ensuring patient safety and patient satisfaction. Extended sources of data capture is something which is coming up by way of whether you have enterprise solutions that you are talking about, social sites, mobile GPS that I touched upon. Uh, Not far early, we used to have this kind of glorified and glamorous designations heard. So this new kids on the block, whether it is the information strategist, the decision support executive, data scientist, or the chief data officers, have started occupying prominence in the organization organogram, and they have been contributing quite meaningfully, not only to the clinical aspects of the work, but also to the non-clinical aspects of the work. While so much data and so much content is floating around, obviously the patient privacy and confidentiality occupies prime importance. And in the healthcare segment, HIPAA laws, in terms of the overall privacy and confidentiality, are something which is done. Most of our bigger setups are already JCI compliant, which is the Joint Commission International, which is the gold standard of healthcare provision. In the Indian context, we have a local body which is known as NABL, which is the authority JCI. We have the NABL accreditations also. And the last and the most important part of big data is the increased data liquidity. I think with more and more data getting converted, merged, fragmented in terms of what is meaningful in terms of the usage of the data thing, I think all those data solutions have really helped us a lot in looking at forecasting trend, in looking at clinical decision support systems to aid better clinical acumen. And more importantly, I think with all this data registry is also something which is occupying prime importance, which helps us in research, publication of academic work, so on and so forth. So last 2 years in particular, I am sure all of us have been through this roller coaster ride with COVID, which started early on. And I think when the pandemic emergency hit us, most of us were unprepared or ill prepared, so to speak. I think, but within a very short period of time in the Indian context, I would very proudly say that Apollo and most of the other private setups have also done an amazing job. I think the frontline worker really have geared up in terms of addressing the challenging issues and evolving issues in terms of the pandemic journey. One of the bigger advantage what we see in this pandemic journey is an adoption of contactless solutions. Our EMR and IT adaptability has enhanced by in a manifold way during the last 2 years in particular. We have had multiple solutions which are contactless. I think contactless screening, contactless handheld solutions, mobile apps have all gathered momentum and gained ground, both in terms of this thing. And one important change that we are seeing in healthcare is a very basic change in how we were providing healthcare and how healthcare is getting availed I think both the aspects have undergone a radical change in the Indian healthcare segment. One good thing, again, another good thing about the COVID pandemic was occupational health of healthcare providers for the first time occupied a significant prime importance. I think unfortunately they were always the thankless workers who were going to the call of duties, but COVID has really given us a lot of introspections and insight in terms of being cognizant of the health of our healthcare providers and their family members. So definitely a lot of great work has happened in that direction, and it has been really a reality call for most of us working in the healthcare segment. Another important element that we have seen is repurposing of resources. I think the kind of agility that COVID has pushed us to get into is the element of very smart way of repurposing assets. So whether it is beds, whether it is resources, there are my consultants, there are nursing staffs, and obviously all of us need to acknowledge that there were times when most of the healthcare workers were indispensed from work because of they themselves getting infected by COVID. So it has been nothing less than a roller coaster journey, but I think the frontline workers really have done a wonderful job, and definitely that is something for all of us to be proud about. Another important element of change element, what we are seeing is unmet healthcare needs of the citizens. I think the fear psychosis of COVID has been depriving them to take care of their regular vaccinations, regular routine visits with their GPs, with their consultants. So that's a important changeover element which we are seeing in the healthcare environment, which is happening now. Public-private partnership, again, I have already touched on this subject, has gathered momentum. We have worked very closely with the public health authorities to evolve a joint initiative in getting into that direction. And what we are seeing now is an hybrid healthcare model where we are giving IT-enabled solutions, we are giving virtual solutions. And it's a mix and blend kind of model, as hopefully we are past COVID now in the Indian context with the fourth wave may not be coming in. But I think independent of that, I think people have adopted themselves quite well, like healthcare providers also, to evolve what is known as a hybrid healthcare model, which is a blended version of physical and virtual kind of thing. And the last and the most important element is, again, from a patient centricity point of view, is personalized medicine. I think this has really occupied prime importance. And maybe all of us as citizens or all of us as new people took our life for granted. I think it was also a reality check and a wake up call for all of us to take care of the health and in terms of our well being. And interestingly, while all this is happening, the concept of behavioral clustering is really occupying prime importance in the healthcare environment. We'll touch base on a couple of these points in the latter part of the presentation. So one of the challenge what we see in most of the industries, and healthcare is again not an exception to that. I think a significant part of the organizational strategy is evolved in typical efforts, where a significant part goes in data collection, data reporting, and very few amount of time or quantum of time is really gone into data analysis and trying to convert that data analysis into organizational strategy. I think the desired effort level is to ensure that this data collection and data reporting and analytics becomes quite seamless in terms of care providers. There can be exception reports which can be generated with all the data that is collated. And definitely this is something which we in Apollo have done quite successfully in integrating HIS solutions. There are real-time reporting, there is trending which is available, there is diagnosis profile of patients which is available. And that has been one of the bigger change element and a game changer for us in terms of using data smartly and using the big data in a bigger way. So this is a typical value chain proposition. I'm sorry that the screen got a little gargled up out there, but it's the IT value proposition what you are seeing on the screen. So as time progresses, with the progress of time, from a value chain perspective, obviously the overall element of data adaptability, whether it is IT solution, big data solutions that we are talking about, moves up the value chain. So right from a rudimentary automated indirect care or patient throughput that we talk about, physician portal that we talk about, gets into a high-end integrated solution, which gets into lot of telemedicine e-solutions, whether it is ECGs or e-ecos that we talk about. And more importantly, one of the bigger change that we are seeing in the Indian context is the continuum of care continuity within multiple care providers. I think this is a big advantage and a big plus. And with a hospital of our repute and our size, very proudly we can say that across 72 hospitals and smaller locations, we have only one UHID number, which is our patient medical record form. So at the end of the day, you don't have to duplicate diagnosis, you don't have to duplicate medical record. The same data of the patient in terms of profiling and historical trending, including his allergies and rest of the information is available across the board in terms of the overall activities. So it has been a good journey again from last 3 to 4 years in particular. I think it has consolidated quite well. And again, these are 10 top applications about artificial intelligence, which have really influenced the usage of data in the Indian context and in healthcare context in particular. I think there are quite a few AI assisted robotic surgery tools which are available in terms of this thing. This has enhanced the quality of care, the outcomes, the length of stay, the usage of blood units, and so on and so forth. And it is a big aiding tool in terms of getting into precision technology. So this has been a good tool which has been adopted in most of the other Apollo setups in the Indian context. Virtual nursing assistants are gathering momentum where a lot of reach element is being provided, where physical and India in the Indian context for people who are new to India is a huge terrain. And unfortunately or fortunately, every couple of kilometers, our language changes, our culture changes. So from a physical distancing point of view, this kind of virtual assistants are a good aid in terms of reaching out to the far remote parts of districts of states or Indian context. AI assisted medical diagnosis is something that we have adopted quite successfully in terms of this thing. And more importantly, during COVID treatments, we have seen that being utilized quite well and seamlessly. Medical imaging analysis, we tie up with multiple hospitals across the segment. And this is how we leverage the strengths of the infrastructure and the support system with credentialed and qualified radiologists who are available on board in terms of teleradiology solutions or the other solutions that we get into. And one of the tool what we use very efficiently within Apollo is to do proficiency testing. So at periodic testing, periodic interval, there are some set of data which are being sent within Apollo units to cross-validate the data and the reporting outcomes which are being undertaken by our clinicians in terms of this thing. Drug discovery, medical data security, again, are certain things which are occupying prime importance. And with more and more data getting liquidated and accessible to most of the care provider, obviously there is always the flip side of fraud, which is quite evident in terms of this thing. And given the kind of focus on patient confidentiality, there are multiple firewalls and the kind of checks and balances that we have integrated within our system to ensure that the data is only meaningful and it is based on need-based basis only, which is being provided to all the care providers or the decision makers. And obviously, as I indicated earlier, with a lot of this data coming in, it has really augmented the clinical trials in terms of getting good, knowledgeable baseline data available for most of the prevailing prognosis and diagnosis within the healthcare system. And on the right hand side, I have just indicated few of the clinical key influencing factors which have really aided the overall data management tools in the Indian context. The list is quite self-explanatory in terms of whatever is happening. And one of the good thing about the Indian context also is there is an active work engagement happening in each and every point that has been highlighted over there. And definitely Apollo being in a leadership position is obviously taking a major chunk of the lead, partnering with the public health authorities and the government authorities. So this is again just to give you a snapshot. I think over a period of time, in most of the private healthcares are now converging from what is known as fragmented digital health to getting into an optimized digital health. I think there is a lot of integration of data. There is a lot of repetitive redundancy has been built in. And I think there has been a fair respectability and credibility of multiple care providers trying to take a overall business call jointly rather than just reinvesting or reinventing the wheel. I think they have started coming back and partnering. So mergers, acquisitions, and partnerships are one of the themes that we are seeing. And a significant part of our growth within Apollo also continues to come from non-generic growth areas, like the generic growth area where standalone hospitals and units continue to do well with adoption of technology, adoption of new beds. But definitely we are seeing a lot of partnership alliances between public health authorities as well as the private segment, which is happening. And there is also an interesting concept where people are wanting to outsource a particular center of excellence. So while we speak on that subject, we have a very successful transplant program at Apollo Navi Mumbai. I am almost hosting 8 units on an outbound basis where I have undertaken the overall liver transplant program for 8 units in the Maharashtra region, the state region from where we are based out of. So these are just to give you a perspective how this kind of things really happen in terms of the Indian context. So again, I think centralized patient data is not about IT. It is all about skills, peoples, and processes, the infrastructure and the backbone. And I think there has been a level of maturity which we are seeing in other healthcare providers also. Looking at rather than looking at IT as just a service support system, they understand the overall power of IT and the big data that it can bring on board. So the overall infrastructure and the backbone has been quite blueprinted while laying out projects in terms of this thing. There's a lot of integration of data which is happening. Research and innovation obviously is the focus. Data storage and purging strategies have occupied prime importance now, and they are in the core discussion point at the board level also. So there has been an enhanced understanding of the power of the data and how it is getting put to use, and more importantly, the confidentiality aspects that I have reiterated earlier as a part of my presentation. And one of the things what we have learned with data is shared learnings and success stories. I think with those kind of data, and it is definitely quite insightful. And one of the mantra which we always follow at Apollo is whatever gets reviewed has a tendency to improve. So the more and more data which gets reviewed at periodic interval, whether it is clinical, non-clinical, and we follow evidence-based practices. So it is not only evidence-based practices for the clinical pathways, but also for the non-clinical pathways. And that has been knowledge sharing has been a wonderful journey across 40 decades, 4 decades of our presence in the Indian context. Identifying lead training and education program is another something. And one of the things which we have been very vigilant, at times getting into the IT euphoria, you may get into what is known as alert fatigues. So what we are trying to evolve is something which is known as actionable alerts. So rather than just popping up, with people disregard any alerts which are just coming on the screen and continue business as usual. That is where very smartly the data needs to be getting into exception reporting, getting into smart alerts which can quantify some kind of actionable against those alerts. The figure on the right hand screen just shows maintaining the fine balance of big data analysis. You must have heard the concept of analysis paralysis. So at times people do get into a little deeper, unwarranted dive into data. And obviously one of the key mantra of big data is we should know when to stop. I think it is very, very important to be very clear and crisp in terms of our understanding as to what is the data that needs to be evaluated and how does that data meaningfully can be converted into my business strategies. So again, I think these are a few of the examples how we have adopted data management within the Apollo ecosystem. So there are HCAP scoring system, which captures all the kind of patient safety goals and patient satisfaction indexes. There are RFIDs and bring your own devices tracking that are integrated with machine learning solutions. Screening and symptom indicators is something which has again occupied prime importance during the COVID pandemic situation. And definitely we had the overall wherewithal and the infrastructure which supported that kind of thing. Clinical decision support system is something which is integrated in our HIS very finely across all major hospitals. Just to give you an example, LASA, which is the look-alike, sound-alike alerts, which are being given to the healthcare providers, are always helpful in terms of looking at drug-to-drug reactions or avoiding those kind of issues. Standard use of templates to make life easier for our clinicians and care providers is something which we practice as a regular affair. Gallup NPS scores are also something which we have integrated quite well in terms of capturing the overall patient safety goals. And this data again gets meaningfully correlated. And I think the UHID, what we call it as the patient reference, medical record reference number, that becomes the common linkage across all segment of data which is being garnered at the hospital level. I think that's the key, how we can integrate the data and look at the same kind of patient with multiple dynamics in terms of activities. So just to give you two quick snapshots, I think this is the overall strong pillars of differentiated care. We follow on ethical, compliance, and transparency standard. These are 5 pillars of our decision-making ability, what we follow at Apollo. It is the service delivery, it is the quality, it is the people, cost, and the growth. I think any business decision that we take needs to flag and add value to any of these 5 pillars is the mantra what we follow. And on the right-hand side is our physician quality reporting initiative. PQRI, as we say, it's a 4-pronged approach what we look into. We look at the outcomes, we look at access, we look at satisfaction, and also we look at patient safety goals in terms of how they are integrated. And needless to mention, all our PQRI data is integrated with IT-enabled solutions. So this is an element which at periodic interval, we get into reviews with individual consultant group, their departments, and we spend meaningful amount of time in trying to convert all this data into a meaningful inference for for our growth, for our strategy indicators, so on and so forth. Six Sigma tool is another important element which we have been using and adopting quite successfully. Everything is data oriented in terms of what we need to get into. The last element, which is our favorite one, is drip. I think most of the organizations are data rich but information poor. So that is something which we have been always alert in terms of ensuring that the data is meaningful and being put to use in the right manner. This is a famous wording which I always cherish. I think earlier, and this was indicated by Sir William Osler 100 years ago. So ask not what the disease the person has, but rather what the person the disease has. I think the whole paradigm shift of healthcare has moved by looking into better care management, which is personalized in nature for a particular patient. One size fits all does not work in healthcare anymore in terms of this thing. I just want to briefly take you through one of the product that we are very proud about. It is an AI-powered healthcare risk assessment. Typically, most of the hospitals undertake health check for a patient. This data captures the overall health check over a period of 3 years, giving me sequential inputs in terms of the aggregated data and the profiling of the disease for that particular patient. The bigger advantage of this tool is I can populate the same kind of data for a cluster of people from a company. So I can go to a company, provide an aggregated data of health check by giving them an index saying that 40% of your people are suffering from back pain, 30% are diabetic, 40% are obese. Let me run a medical management program for you rather than you running an overall medical curative program with me. That has been one of the paradigm shift. And as our chairman, sir, always says, NCD, non-communicable disease, is the biggest tsunami that we are seeing in the Indian context. Obesity in kids is some of the important measures that we are trying to address. And again,
So,
just
so Santosh,
yeah,
I actually have a couple of questions, but can I just clarify? Is this your last slide, or is it
last slide. I think
last slide?
I'm just two slides. I think I will just quickly get through this.
Mhm.
So this is again a four-pronged approach. Multiple elements are happening in terms of data portability, data capturing within the Apollo ecosystem, and I think the indicators are self-explanatory. I would just like to conclude my slides by saying that every organization is perfectly designed to get the result it gets, as has been very rightly enumerated by Edward Deming. Thank you. I needed to rush out in the
Uh,
last two slides, but
Thanks,
nevertheless.
thanks very much, Santosh. And actually, another thing that Deming said was, without data, you're just another person with an opinion. And so
Exactly.
I appreciate you talk about data. Actually, I learned a new term because I thought we were talking about digitization is a key theme of the conference, and data is of this track, and healthcare is your special subject. But you introduced a new one, digital health, because I was thinking digital healthcare, but now you made me realize that actually the whole digital ecosystem that we construct needs to be healthy. And you talk about the data quality, particularly in regard to people's medical information. It's critical to get that right to ensure that data quality is there. So thank you very much for sharing that with us.
Thank you. Thank you, John. Pleasure's all mine.